Hello, my name is James Coker, and I'm the chair for the Department of Sciences at the University of Maryland Global Campus. Welcome to Navigating the Future, our ongoing webinar series where we look at various areas of our society and how COVID-19 is affecting them. Today, we're going to be talking about the case for anti-ageism reform in the era of COVID-19. And today we're joined by Kathrine Im, who is our program director for Behavioral Sciences and Gerontology at UMGC. So let's get right into it. So Kathy, the first question, we're going to be a little bit broad. So how has the field of gerontology been affected by COVID?
Oh, thanks, Jim. Well, as you know, gerontology is both interdisciplinary and multidisciplinary. So you have gerontologists who are interested in epidemiology and disease process, which is relevant in COVID era. But you also have gerontologists interested in psychosocial aspects of coping with COVID, the effects of social isolation and loneliness in older people. You also have gerontologists who are interested in things like public policy and economics, the people who look to government and politics to come up with large-scale policy solutions to addressing the current crisis. So gerontologists have been really interested and invested not only in how the virus impacts older people physiologically, but also in how COVID impacts older people through our social institutions, our policies and practices, because we know that COVID does have a disproportionately devastating impact on the older population. So we know that 8 out of 10 COVID deaths in this country have been among people who are 65 and older, for example. We know that older people who test positive are at a greater risk for experiencing serious illness as a result of being positive. And people who are 50 and older in this country who have comorbidities are at a much higher risk of dying from the virus than younger folks. So the truth is we are a nation of chronic illness and comorbidities. We know that 85% of older adults have at least one chronic condition, and 60%, so a majority, have at least 2 chronic conditions. And of course, this places them at greater risk for severe illness. And it's why the public health community, gerontologists and geriatricians included, have been imploring the public to take measures to prevent the spread of infection, especially among older people. And so thankfully, we are seeing wide-scale efforts to address the crisis. Healthcare providers have been offering telehealth services on an unprecedented scale. And this has been supported by private and public sectors where insurance companies and the Centers for Medicare and Medicaid have changed their rules substantially to be more flexible in terms of how they cover the services that are being offered. The Gerontological Society of America, the GSA, which is sort of the research juggernaut of gerontology, they put together a COVID-19 task force to monitor the COVID-19 outbreak and to share resources. One way they're doing this is to share information sheets on why older people are more susceptible to disease. They have decision aids on how and when to interact with other people during the pandemic, because sometimes you have to interact with people. And they also have information on this campaign that they call How to Reframe Aging in the Age of COVID-19. And this addresses how we communicate information about the virus in terms that are not inherently demeaning or ageist. So those are just some of the things that gerontologists have been pursuing during this very challenging time.
Thanks. And so one of those things, let me pick up on one of the things that you mentioned, which is telehealth, and we'll get to that here in a little bit. But can you talk a little bit about some of the changes that have happened because of COVID-19? But maybe let's focus this time on what are those things that are going to remain in place after COVID is done?
So you mentioned telehealth. I think the most significant change is likely to come out of this is really the acceptance of telehealth as a legitimate and maybe even a preferred modality for healthcare delivery. So under COVID-19, the number of physician visits that have been conducted virtually has really skyrocketed. If we look before COVID-19, Medicare reported that there were about 13,000 telemedicine visits per week. So remember that number, 13,000. In the last week of April of this year, that number jumped to nearly 1.7 million telehealth visits, 1.7 million from 13,000. And between the mid-March and June of this year, there were over 9 million Medicare recipients receiving telehealth services. So you might ask, what happened in April? Well, in April, Medicare, in recognition of the COVID-19 crisis, made important changes that really facilitated virtual visits. So in addition to allowing patients to be seen virtually, they also changed the reimbursement schedules, and they paid physicians the same rate for telehealth and phone services as they would have for in-person visits. That's a major change. So older people without internet technology could still receive the healthcare services they needed just by having a phone call with their doctor. The other thing that Medicare did was to allow patients to see new doctors, so doctors they didn't necessarily have a relationship with before. And they also allowed people to see doctors who are licensed in different states. So we're seeing a real sea change in the way that insurance providers are recognizing the need to expand services in the midst of this pandemic. So, the big question is, of course, does telehealth really work? And I think the jury's still kind of out on that, but we'll see more evidence of this in the next year or so. There has been some research done pre-COVID that suggested that telehealth is effective, at least for some conditions like treating wound care, psychiatric illness, and some other chronic conditions. So for older people, the use of telehealth really depends on whether Medicare will continue to pay for services after the crisis is over. And I think there's, good evidence to suggest that they will. If that happens, it looks like the healthcare industry expects to continue with telehealth after COVID. The AMA has a telehealth playbook to help practitioners get up to speed with the best practices in telehealth. And HHS has launched a site called telehealth.hhs.gov to help patients learn about telehealth and to help providers with billing guidelines, best practices for telehealth, and important policy changes. So it looks like there's really a good chance that the promise of telehealth has finally come to fruition and is here to stay.
Yeah, I know that telehealth has been sort of a big thing waiting in the wings for a long period of time, and that maybe this pandemic will be the thing that finally gives it wings to have it be a real thing, let's say. So let's stick with telehealth for a few more minutes. And can you sort of talk a little bit about what opportunities and possibilities have arisen other than the things that sort of already existed because of COVID-19 with telehealth?
Sure. So, because of COVID, Medicare had to be really flexible to ensure that older people were getting the care that they needed. And one important change was that they allowed ancillary services like behavioral health, physical therapy, occupational therapy, speech therapy, all of those things to be delivered via telehealth. And we know that older patients are huge consumers of these services. So Medicare's flexibility during COVID has really allowed people to receive services from home rather than risking an office visit. But it actually showed that it's possible to deliver these services virtually. So in a sense, they've really let the genie out of the bottle, right? People, not just older people, anyone who needs these services are likely to demand that they can continue to have these visits done virtually to avoid the cost and inconvenience of travel. And, the truth is, for some people, receiving these services is not just a matter of inconvenience, right? So for some people, it's a real deal breaker to have to travel some distance to get to receive these services. So telehealth offers the opportunity for much greater access among marginalized populations, not just older people, but also people in rural areas, the poor, the disabled, and so on. Another unexpected development is that we've seen the importance of using technology to help keep families in touch when their loved ones are isolated, either in hospitals or long-term care settings, which are now off limits to family members. And I'm sure everyone has seen the heartbreaking stories of people who are, really, they're either dying or very, very sick and they're all alone. It's really heart-rending. So being able to capitalize on technology at least helps to address, not perfectly, but it does help to address some of that. So I do think that we'll see internet communication technologists really on top of this to develop easy to use solutions that allow people to communicate much more easily with their loved ones from virtually anywhere.
Yeah, there have been a lot of heartbreaking stories, right, over the last 9 months or so about people not being able to be with their loved ones in their last moments. And technology can help provide a little bit of sort of a gap filler, but it's no substitute for, sort of human to human contact. But there are so many things going on right now. Other than COVID-19, there are sort of all these sort of outcries for social justice and all these other things going on in our world right now. So the last question I wanted to ask you today kind of sort of is at the center of that Venn diagram, right, about gerontology and social justice and all that. So can you talk a little bit, in addition to COVID-19, there's this strong outcry for social justice, like I said. So can you talk a little bit about sort of how all of that is playing out in the field of gerontology?
Yeah, sure. So for me, there are two areas related to social justice. I mean, there are others, but these are the two that I'm kind of keeping my eye on. The first is the need for us to address the issue of caregiving, both formal and informal. The AP last month issued another heartbreaking story documenting that 90,000 long-term care residents have died from COVID. And that's horrible in and of itself. But maybe the more horrible fact is that tens of thousands on top of those 90,000 have died prematurely from neglect due to nursing homes being understaffed and overworked dealing with the COVID outbreak. It really points out that long-term care facilities, in particular nursing homes, are way overextended, and they are being largely ignored when it comes to receiving relief. I think it also points out how important the informal support of family and friends have been in helping long-term care facilities to provide basic care for residents, whether that's brushing someone's hair, helping them go to the facilities. The COVID crisis has really pointed out how fragile and almost unsustainable our current standards of care are for our older patients. And it really speaks to the need for reform. And to me, that is a social justice issue. The other area where we see social injustice has to do with ageism writ large. And this is playing out in social media. So, of course, social media is a great tool for connection. And in fact, older adults are the fastest growing group of adopters of Facebook in particular, but other platforms as well. But there has been an alarming upwelling of ageism during this COVID crisis. There was a study conducted that showed that between January and May of this year, 16% of tweets on Twitter, obviously, contained ageist language or imagery. And a lot of those, especially when the World Health Organization declared COVID-19 to be a pandemic, the rhetoric just was unbelievable, with many people suggesting that older people should die or be killed. So, blatantly ageist stuff. And, as the need for healthcare exceeds capacity, there have been serious debates about who should receive priority. In the early days, Italy in particular was hit very hard by the pandemic. And there was this belief and discussion happening that older people who needed longer intubation times were less likely to survive. There were serious debates about withholding care to older people based solely on their age, not on the physical condition of the patient. And that is ageist, right? ICUs in this country were thinking about policies for maximizing benefits to the largest number of people using age as a criteria. So it's the triage mentality, which makes sense, but age is being used as sort of a rule out for whether or not you will get care. One American politician suggested that older people should sacrifice themselves to COVID as almost like a patriotic duty, right? So what we've seen is that the COVID crisis has really shone a spotlight on the inherent ageist beliefs that older people somehow have less to contribute, that their time is done, and that therefore they're more expendable. So I think it's important to assert that older people have the same right to quality healthcare as younger people. And we do know that COVID impacts younger people too. In November, the CDC issued guidance that Adults of any age are at increased risk of severe illness if they have pre-existing conditions. So if you have heart conditions, weakened immune system, obesity, and in this country, we're somewhere between 30 and 40% obesity rates. Smoking, diabetes, which has become its own sort of mini epidemic in this country. These are all things that are not exclusive to older people, right? Younger people get them too. And yeah, older people, as I mentioned earlier, are likely to have one or more of these conditions. But, it's also important to remember that there are a lot of older people who are as fit, if not fitter, than younger people and would have a really good chance to recover if they're properly treated. In fact, in Italy, a 101-year-old man and a 102-year-old woman have been documented to recover fully from COVID. So the ageist rhetoric we've been seeing really does have parallels to those movements that you alluded to, things like the Me Too movement, the Black Lives Matter movement. As with any ism, racism, sexism, ageism, we're talking about limiting opportunities to access or access to opportunities, limiting resources through marginalization and discrimination. And what these movements have in common is that they're all saying it's not enough to say that you're not a racist, not a sexist. You have to be anti-sexist, anti-racist, so actively working against those isms. And I think we need to be actively anti-ageist as well. I mean, ironically, it's really in our own best interest to be anti-ageist because none of us escapes this thing called aging. And we all get much older before we know it. It catches up with us quickly. So I think it's important for us to pay attention to language, images, behaviors, anything that tells people that they are somehow less than because of what they look like or how old they are. We ought to focus instead on respect, dignity, autonomy, regardless of age, especially now when so many people are experiencing loss and tragedy. I just sort of think that when it comes to all things related to social justice, creating a kinder, more just, more tolerant world, all of us certainly can do better.
I couldn't agree more. And I think these topics and these types of conversations are things that need to happen more and more often in our society, but currently don't happen as often as they should. So one of the many reasons why I was happy to have you here today is to have you bring up these topics and to have us, talk about them, start a conversation, and then hopefully that'll carry on to other people as well. So
that's great.
So that's it for this episode. I want to thank Kathy again for a great conversation and for joining us today. But before we go, I want to mention that this will be the last episode of Navigating the Future for 2020. But please stay tuned as we're going to be picking right back up in January in the new year and talking about topics like doom scrolling, the history of pandemics, and cybersecurity in the COVID era. So thanks again for joining us for these past couple of months, and we look forward to seeing you next time.